Hello to everyone. First of all, I would like to thank to Mr. Emin Çakmak and then THDC's valuable team to everyone who contributed. You already watched our teaser of our clinic, and right now I'm starting with our presentation. Fizyomer Therapy, Physical Therapy and Rehabilitation Medical Center is one of the most distinguished medical centers that implements an innovative and integrative treatment program in Turkey. Fizyomer was founded in 2000 in Eskişehir, Turkey. Fizyomer Therapy, Physical Therapy and Rehabilitation Medical Center was founded by specialist Dr. Türkan Pınarı. She has 35 years of professional experience as a senior specialist physiotherapy and rehabilitation. During the 21 years, she applies her own innovative and integrative rehabilitation programs to the patient with cerebral palsy, stroke, spinal injury, muscular disorders, and orthopedic disorders in Fizyomer Medical Center. Our mission: high-quality rehabilitation for life quality to all people. That's our team. 6 physical therapy and rehabilitation specialist doctor, neurology specialist doctor, 1 internal medicine specialist doctor, a radiologist doctor, dermatologist, 25 experienced physiotherapists, 25 physiotherapy nurses, 4 medical masseurs. These are the medical departments. 6 polyclinics of physical therapy and rehabilitation, 2 adult neurological rehabilitation units, pediatric rehabilitation unit, orthopedic rehabilitation unit, hydrotherapy, aquatic rehabilitation pool, wheelchair rehabilitation unit, robotic spinal decompression unit, lymphedema rehabilitation unit, also medical units, physical therapy and rehabilitation, neurology, internal medicine, cosmetic dermatology, therapy, robotic laser unit, radiology, cryotherapy, occupational therapy, manual therapy unit, dry needling, acupuncture, ozone therapy unit, and 80 physical therapy boxes. What about the treatment modalities? Pediatric rehabilitation, adult neurologic rehabilitation, orthopedic rehabilitation, hydrotherapy, aquatic physiotherapy, wheelchair rehabilitation, occupational therapy, therapy, speech therapy, dysphagia and swallowing therapy. Modalities, hydrotherapy simulator, manual therapy, hand rehabilitation, shock wave therapy, kinesio, PRP, plasma rich platelet therapy, high intensity robotic laser, magnetotherapy, dry needling, scoliosis rehabilitation, acupuncture therapy, spinal decompression therapy with robotic antalgic drug is certificated by FDA, cryotherapy, cardiac rehabilitation, ozone therapies, pulmonary rehabilitation, post-COVID rehabilitation, cosmetic dermatological applications, massage therapy. Pediatric rehabilitation, we have got 25 years experience on CP and myopathy. Neurological disorders is experienced specialist doctor, good at stroke. Wheelchair rehabilitation is nowadays innovative treatment modality is VR. Is available, is usable for stroke, MS, Parkinson, and etc. Spinal decompression therapy, robotic antalgic drug is our success rate is 95% with robotic antalgic drug. This machine also certificated by FDA that's usable for spinal hernia, cervical hernia, sports rehabilitation, orthopedic rehabilitation. We are good at sport and orthopedic rehabilitation, meniscus injuries, traumatic after accidents, sport injuries like ACL. Hydrotherapy is effective on adult and pediatric rehabilitation program, neurological disorders, scoliosis, kyphosis, CP, cerebral palsy, stroke, herniated disc, hemiplegia, paraplegia, tetraplegia, and spinal cord injuries. Cryotherapy is effective also pain and edema relief, traffic accident injuries, sport injuries, tendon and meniscus laceration. PRP, plasma-rich platelet therapy, has got success about arthrosis, especially on knee. High-intensity robotic laser therapy. What does this laser do? Edema relief, nerve regeneration accelerator, facial paralysis, cervical, lumbar, spinal cord hernia, and effective on sport rehabilitation. Dry needling effective on fibromyalgia. Obesity and painful syndromes are reached a solution with this acupuncture therapy. What specialties in the Fizyomer Medical Center are most demanded? Cerebral palsy rehabilitation, rehabilitation after stroke, rehabilitation after spinal cord injury, facial paralysis rehabilitation, rehabilitation after brain injury, orthopedic rehabilitation after hip bone and knee replacement, post-COVID-19 pulmonary rehabilitation, cardiac rehabilitation, spinal decompression therapy with robotic antalgic tract after lumbar and cervical hernia. The diseases that we apply successfully on pediatric rehabilitation: cerebral palsy, cerebral injuries after trauma, osteogenesis imperfecta, muscular dystrophy, neuromuscular disorders. The another one is adult neurologic rehabilitation, which we are applying successfully: stroke, post-traumatic brain injury, spinal cord injury, encephalitis, multiple sclerosis, neuromuscular disorders, cervical and lumbar disc hernia, facial paralysis. Pediatric and adult orthopedic rehabilitation: fractures, part injuries, amputation and advanced prosthesis applications, post-polio rehabilitation, post-operative rehabilitation, hip bone and knee replacement rehabilitation, arthritis, strains, back and neck pain, spinal conditions. Our international patient portfolio: every year, 350 patients with cerebral palsy, stroke, spinal injury, and orthopedic disorders came to our Center for Fizyomer individual integrative rehabilitation program from the several countries such as Ukraine, Germany, Belgium, Holland, England, Kuwait, Lebanon, Finland, Uzbekistan, Kyrgyzstan, Turkmenistan, Kazakhstan, Azerbaijan, Algeria, Sudan, Iraq, Syria. This is the important note. We accept patients between the age of 6 months and 90 years for treatment. Why should I have to trust Fizyomer therapy? First one, 21 years experience on the pediatric rehabilitation for cerebral palsy. Another one, 21 years experience on the adult neurologic rehabilitation on stroke, brain, and spinal injuries. The third one, intensive and integrative rehabilitation program. Fourth, innovative treatment program. High technology treatment modalities. 93% success rate of annually. We are offering 10 advances to the international patients Fizyomer Medical Center. The first one, in addition to classical treatments, our individualized integrative rehabilitation programs that include innovative modalities such as virtual reality rehabilitation, robotic assisted rehabilitation, and aquatic exercise rehabilitation. Second one is the important one also. Intensive treatment programs are applied intensively to patients for 4 hours per day. Our treatments are very cost effective because of the patients are accommodated in 4 or 5-star hotels and residence suites near of the medical center. This provides higher accommodation comfort while providing lower hospital stay cost for the patient and the company. We provide 24-hour, 7-day medical assistance, free transfer between hotel to medical center daily. We offer to the all patients and a company free city tour only once during the treatment times. This one is also important note for the patients. We provide to the all patients free airport transfer two-way by our reliable and friendly experts. We provide the free translator support in Russian, English, German, and Arabic. Turkish cuisine and international meals. The last one is the also important one. Eskişehir is the safest city in the world. These are the locations. Eskişehir is the 3.5 hour far from Istanbul Airport, 2.5 hour far from the Istanbul Sabiha Gökçen Airport, 2 hours far from Ankara Esenboğa Airport, 1 hour far from Zafer Airport by car. Also, there is a local Hasan Polatkan Airport in Eskişehir, but currently there is a 2-day reciprocal charter flight from this airport to the Brussels and some of the European cities. Our integrative rehabilitation programs accelerate the improvement of the patient with cerebral palsy and stroke. During the 21 years, it has been working with expert team in the field of pediatric rehabilitation and neurologic rehabilitation. Our spatial intensive integrative rehabilitation programs that are developed by using innovative devices are successfully applied on the patient with cerebral palsy and stroke and spinal injury patients. Classical rehabilitation programs are usually consist of the basic physical therapy applications such as electrotherapy, ultrasound, shortwave, etc. Devices plus rehabilitation exercises. In the classical rehabilitation programs, improvement of the neurologic disorders takes approximately 6 to 12 months. We are preparing 1-month intensive and integrative rehabilitation programs for the patient. We give to the patient a total of 4 hours rehabilitation per day, 2 hours in the morning and 2 hours in the afternoon. After the patient's neurologic exam, we add the innovative devices and methods to the treatment according to the patient's neurologic condition. For example, if the patient has spasticity, we add this cryotherapy or buttocks therapy to the program. If the patient has motor impairment or muscle weakness, we are adding the robotic laser therapy plus virtual reality rehabilitation and aquatic rehabilitation to the treatment. If the patient has balance and coordination impairment, we add the virtual reality rehabilitation plus robotic assisted balance and walking therapy to the program. Our medical council creates an individual integrated treatment program for each patient. These programs are applied to the patient by expert physiotherapist team during the 1 month. Our comparative treatment results of the medical center in last 2 years. Integrative programs are applied in total 153 cerebral palsy patients. Their age range is 6 months to 22 years old. After the 1 month treatment, 30.7% of the 52 patients who received classical rehabilitation programs had improvement in neurologic disorders. However, 75.2% of 101 patients who received our integrative rehabilitation program had improvement in neurologic disorders. In the same period, in total, 250 stroke patients were applied to our integrative rehabilitation program. Their age range is 32 to 78 years old. 46% of 63 stroke patients who received classical rehabilitation programs had improvement in neurologic disorders. However, 81.2% of 187 stroke patients who received our integrative rehabilitation program had improvement in neurologic disorders. As a result, we observed that our intensive and integrative rehabilitation programs that early applied on the cerebral palsy and stroke patients speed up their improvement in the neurologic disorders. Finally, we want to say that our annual clinical success rate is 93% in all of the neurologic rehabilitation patients. These are our new departments, Fizyomer Dental. Dental clinic of the Fizyomer applied in cosmetic dentistry, oral and dental health, oral surgery, teeth jewelry, digital smile design, bleaching, dental prosthesis, endodontics, conservative treatment, preventive dentistry, periodontics, panoramic X-ray, orthodontic treatment, dental implant, oral surgery, TMJ, temporomandibular joint disorders. What about the Fizyomer aesthetica? We are applying dermatology clinic, laser epilation, facelift techniques, skin regeneration and rejuvenation, neck lift without surgery, wrinkle treatment, acne and acne scar treatment, wound scar treatment, telangiectasia and pigmented lesion treatment, spray treatment, brow lift without surgery, body laser skin tightening, sunspots, melasma, hyperhidrosis, hair transplantation, follicular unit extraction. We have been using through FUE technique for many years to achieve natural looking and lifelong results. Hair health treatment with PRP. In the PRP procedure, the patient's own blood is drawn and treated in special instruments. Here, the fraction that nurtures and develops the fibroblasts is separated and injected into the area of hair loss. This method is particularly effective in genetic hair loss. Furthermore, the PRP treatment can be combined with hair mesotherapy in the patients with genetic hair loss. We wish the high quality life for people all over the world. Thank you. And also, I would like to show some information about this. Our contact, you can contact from this line with directed to all of your questions, all of your queries. Thanks to everyone.